afternoon. Before opening remarks and your questions, a reminder to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. This briefing is being streamed live on YouTube, and the audio is available on WisconsinEye. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestone, the Chief Legal Counsel for the Governor's Office. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks everybody for being with us today. I'd like to give you all an update on some of the good work that's being done to help keep folks safe as we navigate this crisis. But before I do that, I just want to reiterate a message you've heard from me before. You are safer at home. Staying at home will help us save lives. This is tough. We're having to see one another. We're seeing one another online instead of having a potluck with an extended family. We aren't going for bike rides with our friends. We aren't meeting with work colleagues for tea or coffee like we usually would. My kids and grandkids aren't coming to visit me and the First Lady at the executive residence right now. I'm holding cabinet meetings on the phone instead of in person. But that's a sacrifice we are asking of everybody in the state. Stay home and limit the number of people you have contact with. This kind of distancing, it's difficult. We know it is especially draining both mentally and emotionally, but it's one of the most effective ways of stopping the spread of the disease. And folks, we need to take this seriously as it gets more urgent and more dire every single day. We're seeing COVID-19 impact Milwaukee, especially the north side of Milwaukee, in a uniquely bad way. The severity of this disease in the African American community, it's a crisis within a crisis. We must do everything within our power to raise public awareness, ensure access of care, and find out why this happens. Right now, the Centers for Disease Control has a team in Milwaukee, and we hope to learn more from them in the coming days and weeks. Now, let's talk about price gouging for a minute. I will continue to monitor this information not only from a public health perspective, but also to ensure that swift action is taken against price gouging in our communities. While most Wisconsinites are good neighbors who are caring for one another, there have been reports of a few bad actors. Those folks will be held accountable. I want to talk a little bit about what we're doing to keep our healthcare workers and first responders safe. Yesterday, we launched an initiative designed to get more personal protection equipment, or PPP as it now is known as, such as gowns, gloves, and masks to those working on the front lines in response to the COVID-19 epidemic. It is absolutely imperative that our healthcare workers and first responders have the equipment they need to stay safe and healthy as they care for our communities. There's a global shortage of PPP, and we're competing with other states to acquire limited resources. So we're calling on companies and schools and other organizations that may have unused protective equipment sitting in their facilities to make those materials available to those who need it most. The state appreciates any donations, but we're also prepared to pay a fair market value for large quantities of this equipment that are offered. Wisconsinites can now go to COVID-19 supplies, one word, .wi.gov/donations to either donate or sell large quantities of PPP to the state of Wisconsin. The State Emergency Operations Center will then distribute the PPP to communities that need it most. We've had an incredible amount of outpouring from offers from businesses and other organizations who have already told us they want to help fill critical need for this equipment across Wisconsin. We continue to review these offers of support, and our hope is this site will help to streamline that process going forward so our workers on the front line get what they need as quickly as possible. Earlier today, I announced an emergency order that will suspend evictions and foreclosures amid the COVID-19 public health emergency. Now, of course, Wisconsinites who are able to continue to meet their financial obligations are expected to do so. This order does not in any way relieve a person's obligation to pay their rent or their mortgages. But we are mindful that during this time, individuals, families, and small businesses may see disruptions in paychecks due to losing hours, tips, businesses, or employment. This order is another step we can take to prioritize the health and safety of Wisconsinites during this public health emergency. Evictions and foreclosures pose a direct and serious threat to the health and well-being of Wisconsinites, especially as we ask that everybody remain safer at home. Another issue that I know is on the top of the mind of many folks is the upcoming election. We've heard from countless people across our state who want to exercise their right to participate in our democracy. And I say to them, I hear you. My focus has been and will continue to be ensuring that everyone has the opportunity to safely cast their ballot in the upcoming election. I don't care who's running for office or what's on the ballot, everybody should be able to participate in our democracy, period. I understand that Republican leadership the other day expressed their support for not delaying the upcoming election. But as elected officials, our top priority has to be everyone's safety. So I'm hopeful that all of us can agree that everyone should have the right to exercise they can exercise their right to vote. And that means we have to work together to ensure that people are safe when they do that. So today I'm asking the legislature to come together in a bipartisan way to change the law to ensure that every registered voter receives an absentee ballot to vote in the upcoming election, to consider absentee ballots valid if they're postmarked on the day of the election, and to extend the time period to give our clerks extra time to count the influx of ballots. We need to be doing everything we can to ensure that folks can cast their vote while still staying safe at home. So I'm hopeful that the legislature will act swiftly to send absentee ballots to every single registered voter living in Wisconsin. And folks, let me be clear, this isn't a Republican or Democrat issue. This is an issue that faces our democracy. I don't care who gets the credit. I just want to make sure that everyone has a chance to cast their ballot this April. A record number of people have already requested absentee ballots, and that's the good news. I urge you to visit myvote.wi.gov to request your ballot today. Our local election clerks are doing their best, but they need help, and voters need help. Everyone deserves to be able to safely cast their ballot in these difficult times. The legislature needs to step up. Now, folks, I'll again say that I know we are in uncharted territory. Things are tough, and they're going to get worse before they get better. But together we can make a difference. So please stay safer at home. So thank you very much, and now I'm going to turn it over to DHS Secretary Andrea Palm.
Thank you, Governor Evers. Good afternoon, everyone. I'll jump right in with the numbers. Today, we have 13,140 negative tests, 842 positive tests, and we now have 13 deaths in the state of Wisconsin. Those 5 new deaths range in age from their 60s to their 80s. In addition, as part of our daily DHS website update, you will now be able to see that we are providing additional data points. This includes the age ranges and genders of those who have tested positive and those who have died from COVID-19. This is part of our ongoing effort to be transparent and to provide information that helps inform and protect our citizens. Now, hearing the numbers today, you may think that safer at home, physically distancing, washing your hands, and covering your coughs and sneezes aren't working. But I want to stress something we talked about earlier this week. Without implementing safer at home, our models show us that we would likely have 22,000 Wisconsinites who are infected with COVID-19 by April 8th. And so now is the time to to do everything we can to flatten the curve, to keep that projection from coming true. Lives truly do depend on it. And I want to spend just a minute on what you're likely to see in our daily case updates moving forward. Assuming that we are all implementing Safer at Home well, it will likely be several weeks before we are able to start to see the results of those efforts. And that is because of the lag time between infection to symptom onset and ultimately to a positive test result. And so the numbers you're seeing today and in the near term are people who were infected before we started Safer at Home. So please don't get discouraged. We need you to remain vigilant and continue to do everything we can together to stop the spread of COVID-19. It's ironic, really, that in a time when we need each other, we aren't able to be physically close to each other. We need to be 6 feet apart. We can't meet for happy hours. We can't go visit our parents or our grandparents in a nursing home or assisted living facility. But as we have talked about previously, physical distancing really is the way to stop the spread of this disease, and it does not have to equate to social dislocation, disconnection, or isolation. We are so impressed with the ways you've found to stay connected and adapted to this new normal. We are grateful for the way so many of you have asked, what can I do instead of what's in it for me? Yet we also know that being isolated, fear of getting sick, stress from work, childcare, food, other pressures can all pile up to make you feel overwhelmed, anxious, and even depressed. Telling someone about how you're feeling isn't a sign of weakness. It's necessary for all of us to survive in this anxious and ever-changing situation. And so we want you to know about a few resources. If you need to, please call 1-800-985-5990 to speak to a trained crisis counselor or text TALK WITH US to 66747. Other resources to maintain your mental health and well-being can be found on the DHS COVID-19 web pages. And we will continue to talk about this issue in the future, as it will continue to be something that we all are struggling with. As we enter our first weekend with Safer at Home, the governor, DHS, and other state agencies and our local and tribal partners continue to develop and implement action steps and supports to be prepared and to do the work we need to do to respond to this outbreak, as well as to focus on our most vulnerable citizens, including our older residents. We'll continue to pursue every avenue to provide our heroic healthcare workers the equipment they need to stay safe and do their jobs, as the governor just mentioned, and we will continue to make sure we are providing you accurate, timely information to help you navigate this unprecedented situation. Finally, again, I just want to reiterate how grateful we are to each of you for your work to do this together, to really help us break the spread of COVID-19. With all of us doing our part, staying safer at home, we certainly will get through this.
Okay, thank you. We'll now open it up to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And for the sake of time, we also want to remind you that we are taking one question per reporter per outlet, so we can wrap up about 2:30 this afternoon. So we'll begin the questions with Frank Zufall from the Sawyer County Record. And a reminder, *6 to mute and unmute your phones. Frank? Frank Zufall? Okay, we'll move on then to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call again today. Governor, you had said earlier that you were considering looking at some kind of executive order to require absentee-only balloting. Why today are you calling on the legislature to do that? Why are you not instead using some kind of executive power to make that happen?
We believe that the legislature is the best place to make that happen. They are the ones that most of this is in state law, as I've said before. So we're asking them to do that, along with making sure that the clerks have the ability to actually count the votes and get them out. There's a lot of moving parts here, but the legislature is is the one that can make this happen. Do you have any comments?
Yeah, and I think that's correct, Governor. And the other thing to add to that is the governor could issue an order today and it would result in a lawsuit tomorrow. There's already 4 pending lawsuits that are being currently argued right now in federal court. Issuing an order today would probably result in a 5th lawsuit. And as the governor said, if the legislature acts today, that's the way that the most certainty can be provided. It's the way that we can avoid further litigation and uncertainty. And as the governor laid out, there's some simple, easy steps that the legislature could do to make sure that we have a safe, fair, and open election.
Thank you, Scott. To Micah Selner from the Appleton Post-Crescent. Micah?
Hi. I'm just wondering if you could just kind of talk about how the increase of tests have come about and if there are testing outside of the state lab.
Sure, Micah. This is Andrea Palm. So we're tracking about 2,000 tests a day here in the state of Wisconsin among about 40 labs across the state, so including the state lab and Milwaukee Health Lab, which you all have heard about, but a number of clinical and hospital labs and some private labs as well. We continue to work to increase our lab capacity, our testing capacity, but I do also want to, as we have discussed before, make sure that folks are tracking on the fact that we do continue to see some shortages, potential shortages in some of the ingredients that are necessary for these tests, and so we are also tracking very closely access to all the pieces that people need to continue to run these tests. But we do continue to track at about 2,000 tests a day and are working to expand capacity.
Thank you, Micah. To Charlie Presser now from the Crawford County Independent. Charlie? And a reminder, *6 to mute and unmute your phones. Charlie Presser from the Crawford County Independent. Okay, we'll move on then to John Doran from WLUK, Fox 11 in Green Bay. Fox 11. Okay, moving on then to WTAQ Radio, Rob Sussman. Rob?
Yeah, thanks for taking my question. I was wondering, we've had a couple of local health officials here in Green Bay mention that there are likely a lot more cases than the ones that we know about and are confirmed. Is there any estimate as to how many people might have COVID-19 in Wisconsin right now that have not been confirmed as positive cases?
Yeah, Rob, it is certainly safe to assume that there are more than our positive number of cases, considering the prioritizing we are doing to ensure that our frontline healthcare workers and those in hospitals and long-term care are getting tests. But I think Dr. Westergaard could drill in a little on the details.
Sure. I think to add to that, in data from all the other countries where the virus has been circulating for a longer period of time, we've learned by testing subsets on a research basis that a significant proportion of people have mild or no symptoms at all that can still be positive and still transmit the virus. So by only testing people who come to medical attention, we're missing a large proportion of people with the infection. And we want to find the sweet spot. We don't think everyone should get tested because we need to preserve the resources that we have, and we also don't need to expose healthcare workers for people who don't need treatment. Because to remind everyone, we don't have a specific treatment for the virus. Most mild cases will get better on their own in the home setting. So we want to understand the size and speed of the epidemic by testing just the right subset of people. So right now we're prioritizing people who are hospitalized, but it's clearly true, and it's safe to assume that the number is possibly as high as 10 times as many people who have been infected compared to what we've diagnosed. That's what some of the models have shown, that that for every one we've diagnosed with a positive test, there may be 10 people in the community who are infected but haven't come to medical attention. So that's one of the parameters of the models that we've been using to identify the likely future spread.
Thank you, Rob. Now to Addie Bink from WFRB in Green Bay. Addie?
Hi, can you hear me?
Yes,
Yeah.
we can.
Yes, I believe my question will be for the governor. But we've received some reports of people who are trying to register with unemployment, both online and over the phone. And they're having a massive problem with it. Either the website is crashing, they can't seem to get through on the phone. What do you have to say for those people that are really struggling at this time?
Well, I know occasionally that happens, but we have registered tens of thousands of people thus far. So some people are getting through, but we continue to bring more people into the system, and I just heard a report last night from our Department of Workforce Development that we're increasing staffing. We have increased staffing from day one, and we're also beefing up the technology. We're in a good place. I mean, I know you hear from people that are struggling, but we have successfully registered, as I said, tens and tens of thousands of people, and we will continue to do that. But it is never going to be foolproof, and we will continue to do the best we can. But I think we are ahead of the curve there.
Thank you, Addie. Now to Sarah Thompson from WBAY in Green Bay. Sarah?
Good afternoon. I think this question would probably be for the governor. We're still getting a lot of phone calls and messages from people saying that their employer is requiring them to go to work, or that they don't believe that they are an essential worker, and they are afraid of losing their jobs and not having any kind of income coming in, and say that when they call local law enforcement, they're not getting any kind of a response. What can those people do?
Yeah, great question. I'm going to ask Ryan to take a crack at that.
Sure. So we've been doing a number of things on that front in terms of making sure that people are complying with the order, and it does, it can be a tough situation for an employee. One of the things that people can do is they can contact the WEDC in terms of who is and who is not essential business. They can contact local officials. This is in order because of how state law is, that local officials are the ones who enforce the public health order. And we've also been working very closely with Attorney General Call on making sure that the order is being enforced, that local law enforcement knows the parameters. And we've heard a lot of stories and been in contact with a lot of local officials who are actively enforcing the order.
Yeah, and I'll also add, I believe on the DHS website, several businesses and frankly, labor organizations have created a list of criteria for safe workplaces. And so I would encourage people to take a look at that also.
Thank you, Sarah. Now to John Nizer from NBC 26 in Green Bay. John?
Hi, good afternoon. Has there been any discussion or conversations about allowing golf courses to stay open in the state?
Under the current order, places of amusement or entertainment are considered non-essential businesses. So what the order does is it classifies based off of what the U.S. Department of Homeland Security does. We also have the benefit of looking at what other states do, and in order to minimize the amount of contact and help bend the curve, is one of the categories of businesses that were deemed non-essential are entertainment places. So whether it's a golf course or a movie theater or an arcade, they're deemed non-essential and therefore cannot be open during the Safer at Home order.
Thank you, John. Now to David Walberg from the Wisconsin State Journal. David?
Yes, hello, thank you. President Trump has asked states to divide counties up into high risk, medium risk, and low risk based on surveillance testing. Do you agree with this approach? And the idea is that lower risk counties can resume normal activities sooner. Do you agree with this approach? Do you plan to divide counties in Wisconsin this way, and how do you plan to do that?
I'll just give my example or my reference point as someone that heard that conversation. I think we're a long way from that as a country to suddenly be able to identify low risk. I mean, we have several counties in northern Wisconsin where there hasn't been an identified positive COVID-19 virus infected person. That doesn't mean they don't exist. We had a death in Iron County yesterday, one of our least populated counties. So I'm not, the president actively wants to articulate a policy that I don't believe is going to be workable at the state level. That said, he's the president; he can do what he wants to do. But I am concerned about sending the message to the people of Wisconsin or the people of Illinois or Michigan or Minnesota or surrounding states that says this part of your state's okay, so you don't have to do a stay at home there. That we are not anywhere near that point of view. I don't know if you have anything to add, Andrew. No. That's not.
I would characterize the risk in all Wisconsin counties as high right now, and that's not to say that there aren't areas that are particularly high or have particular urgency to do testing and surveillance and be proactive about bolstering and preparing the healthcare system. But I think what we've seen on how the virus has spread globally is that every geographic area in the world is at risk for an expanded epidemic in the coming months.
Thank you, David. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, thanks for taking our call. This kind of goes to workplace safety as well, so maybe for Governor Evers or the Chief Legal Counsel. But we're wondering with some of these businesses who are still open as essential businesses and keeping workers working, if they have a confirmed case of COVID, are they told to shut down? Is it on a case-by-case basis, or do they have any legal obligation to tell the rest of the employees that another employee has been either exposed or confirmed with a COVID case?
I think actually I might hand that one over to the medical professionals and Secretary Palm.
So this is right, the fundamental part of the public health contact tracing piece of this. If someone tests positive, they are notified of their test result, and then that contact tracing starts. So it's a conversation about where have you been, who have you been in contact with, and the effort begins to be in touch with the folks that were contacts of this positive case, to do the tracing, to get people into isolation so that we can stop the spread of the disease. That may include notification of coworkers, but that does not necessarily mean notification of the employer themselves. But the public health boots on the ground work of contact tracing and how we part of how we help stop the spread is this work to figure out extensively who that positive case has been in contact with, and therefore who else needs to go into isolation from that contact.
Yeah, I would just emphasize that there's all in public health, as in healthcare, there's a balance in protecting people's privacy and protecting safety and infection control. And so any sharing of exposure is really for that. It's on a need-to-know basis. We notify people in public health when they might be at risk of having been exposed to a disease, and that's the guiding principle. It's not to violate people's privacy. We protect it as much as we can, but the contact tracing notification is to identify who's at risk so we can do the right things to protect them.
Thank you, Danny. Now to Stephen Cohn from News 3 in Madison. Stephen?
Hi, can you hear me?
Yes, we can.
Cool. So I've seen other states do something where if you enter the state, you should self-quarantine for 14 days. Is there any chance that if you come from a hotspot like Chicago or Illinois right now, that would be asked of you if you enter Wisconsin?
Sure. So our guidance to people returning from areas that have been hotspots, as you say, has really been an evolution. It was one of our early interventions was to identify the countries in the world that the federal government has identified as level 3 travel advisory countries where there's widespread community-based transmission, and when people return from those, we ask them to quarantine. So it certainly is conceivable that coming from a place like New York City, where there's now widespread transmission, or Chicago, that would be an advisable recommendation. Right now, with the Safer at Home order, really we're already in a position where we don't want people to travel at all, and we want people to stay in the home. So it kind of serves a similar function. So we're de-emphasizing screening for returning travelers and really emphasizing don't travel at all because of the risk of exposure in the communities.
And I would just add quickly, the calling people across the state, mainly local officials, county officials, and so on. There are counties and areas in the state of Wisconsin, especially northern Wisconsin, our recreational hub, frankly, and those local officials are concerned about people coming from, because of second or third homes that they own in that area from out of state, and what the potential cost would be if there was an outbreak at that time, not necessarily around those individuals, but their ability as small counties to respond to that. So it's something we're looking at. Clearly, I've seen counties and other recreational areas saying, please stay at home, but that I have to just reveal that is an issue for many of our smaller counties.
Thank you, Stephen. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Hello, good afternoon. So my question is kind of about, and it might be too early to know, but as we continue with social distancing and our safer at home order here, as we get the numbers every day, the updated negative cases and positive cases, will we at some point begin to get the number of recoveries as well? Because I think that is also important to share with the public as we move through this.
So I'm going to let Dr. Westergaard talk about this issue of recovered cases.
Yeah, that's a really good question. It's something that we've talked about on an ongoing basis. Some of the global dashboards of counting cases, of diagnosed cases, have listed the number of timing of people who have recovered from the illness. We're finding that problematic because those data aren't collected by surveillance in a standardized way, and we're hesitant to report something that's not accurate or not based on fact. What we can say, what we'd like people to understand about this infection is that it is an acute respiratory infection. And acute means it comes, and in the majority of cases, it runs its course and goes away. So the majority of people are going to fully recover, and the average time that people recover is about 1 to 2 weeks. So the expectation is that most people who are diagnosed will recover, and when we report our cumulative number, as time goes on, as weeks go by, most people will have recovered. We're to be most accurate. Our approach has been to report total numbers of deaths, and number of hospitalizations, and just try to educate the public that what is the normal course, which is that this is a self-limited infection that people don't live with their whole lives. They're ill for a while and get better. So we're exploring different ways to do that, but our hesitation is we don't want to report numbers that aren't really accurate, and there isn't a way that we systematically capture when people stop. We don't repeat test people, for example, so we don't have a clear way to report that. So we're exploring the best way to communicate that with the public, but right now we're focusing on diagnoses and deaths.
Thank you, Tajma. Now to Jeremy from Urban Milwaukee. Jeremy?
Pass.
You pass? Yeah. Okay. To Tiffany from CBS 58 in Milwaukee. Tiffany? And a reminder.
Yes, Governor, can you get more specific? How much personal protective equipment does the state currently have, and how much is being asked by the medical systems?
I think, I don't know if Secretary Palm has those numbers, but it's a dynamic level, and we can definitely put those numbers out later. But one of the things we've been doing at the State Emergency Operations Center is working with FEMA, working with the federal government in terms of being able to access the reserves of the Strategic National Stockpile. As the governor also mentioned in his opening remarks, the state recently launched an effort where we are accepting donations of personal protective equipment and buybacks. We've been working around the clock in terms of finding suppliers and vendors to be able to make large purchases of that. And we do have supplies in the state warehouse. Those are being distributed on the hour, so there isn't a static number in terms of the number of masks or the number of gloves, because as we're getting new supplies in, we're pushing supplies out to those around the state who need it most.
Yeah, and I can just add from a macro level, excuse me, that we continue to be a bit frustrated with the idea that somehow states are pitted against each other. It doesn't work, and it creates takes more time, more effort, and frankly, it increases the cost. In the perfect world, as in other large issues, disaster issues, the federal government has taken the lead on that. Now we find ourselves sometimes actually competing with the federal government on those buys. So it's not a perfect system. We're trying to make it better.
Okay, thank you. Now to Casey from Fox 6 in Milwaukee. Casey?
Hi, good afternoon. Thank you for taking the call. My question is, what is the average wait time for testing, if you know that, at both state and private labs, and all tests still at this time being preserved for the most symptomatic patients first?
Sure, I'm happy to take a stab at that. This is Andrea. So we are continuing to prioritize testing to ensure that our frontline healthcare workers, folks in congregate living settings like long-term care where they are particularly vulnerable, as well as hospitalized patients are getting top priority for those tests. The state lab and our partners continue to run on about a 1 to 2 day turnaround time. Obviously, there are the sample needs to make it from where it was taken to the lab, whether it's the state lab or another lab. So there are transit times that need to be added to that 1 to 2 day turnaround time. But we are not in a backlog situation, if that gets at what you're asking. But we do need to continue to expand capacity to test and are working to do that.
Okay, thank you, Casey. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Good afternoon. Good afternoon. Can we talk a little bit about the rate of growth so far? Is it low? And if we don't hit the 22,000 positive cases by April 8th, will that essentially signal the state has weathered the worst case scenario?
I'll let Dr. Westergaard jump in here, but one thing I do want to clarify is this sort of tip of the iceberg thing we were talking about a bit ago. The 22,000 number is people infected, right? It will only be a subset of those that have actually been tested and come back positive, because we're not testing everybody. But what we know is at 22,000 infections by April 8th, the subset of those who need to be hospitalized and who will be severely ill puts enormous stress on our healthcare system, and that is why the stay-at-home order is so important now, so that we don't get to the place where we have 22,000 infections by April 8th.
I think that's a good way to describe it. Many of the models or the forecasts that we've seen using U.S. data say that the peak, the point where we reach the maximum number of new cases and then the number of new cases per day starts going down, might be 2 weeks away. And we want, our goal with all the limitation of close contact between people is for that peak to happen early and for it to be as small as possible. If we didn't do social distancing well, there would be a growing number of people who become infected, and the peak would be higher and it would take longer to get there. So I think that was a thing worth emphasizing in the Secretary's opening remarks, is that even if we see a doubling between now and a week from now with cases, that doesn't necessarily mean that we're not doing the right thing right now. In fact, the cases are still likely to go up. But what we want to try to avoid, and what the model so might happen if we didn't do this extreme social distancing, is that the peak might not happen until summer, and then it's going to be many-fold higher. So the best case scenario right now would be that we see a peak in the next 2 to 3 weeks. And that's really what we're going for, because a good number of people have been infected already in an asymptomatic period. So that's our hope right now, and it's a point we want to make sure people understand, is that right now is the critical time to implement safer at home, so we don't let that peak get further away and higher down the road.
Thank you, Rachel. Now to Nick Bohr from WISN TV in Milwaukee. Nick?
Hi, Governor. Earlier you had mentioned that there was a disproportionate number of African-American deaths in Milwaukee, and you also said that the CDC has a team in Milwaukee. Are those two things related? Can you elaborate on the CDC's mission here specifically?
Yeah, I'll let Secretary Palm answer that directly, but they are in Milwaukee, and they're there for various purposes. Now, whether they're there specifically for this issue, I don't know that, but believe me, I have to believe the CDC being on ground zero here, they will likely be interested in taking a look at that and hopefully have some comments about it. I don't know if I need to add anything else, or you do.
So CDC has joined us in the state of Wisconsin a number of times previously. When we had our first case, they did send a few folks to help out. They sent a few folks into Fond du Lac when we had a little hotspot there, and now a subset of those who were in Fond du Lac are now in Milwaukee helping on the ground there, as well as doing some work scientifically. Right, we are all chasing the science on this virus, and so they certainly are here. They are other places around the country pitching in and helping to develop the science so that we can all learn and make sure that we are responding and doing everything we can based on the data as it emerges and evolves in this outbreak.
Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Thanks for having this call. I'm wondering if the state is considering any special measures for the cluster of cases on the north side of Milwaukee.
So I think as we've talked about the contract, I keep getting that word wrong, contact tracing piece of this continues to happen with every case, and it is a really important part of what our colleagues in Milwaukee are doing on the ground to help get their arms around that cluster. And as we just talked about, CDC assets are also there working with them to help them in that effort. And we're also obviously in very close touch with the healthcare systems there to make sure that they have what they need and that they are ready and able to handle cases as they come into the hospital systems. But I don't know if you want to say any more.
It's really a partnership. We're doing all the things that we normally do in terms of identifying contacts and recommending isolation and quarantine. But when local jurisdictions have an excessive number of cases, we do what we can at the state level to back them up with additional workforce and other federal partners as well. So we're doing everything that we know how to do to minimize the spread of the virus, and that involves going where it seems to be spreading most quickly and doing interventions in those communities.
Thank you, Molly. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. Governor, this question is for you, and it relates to the election and absentee ballots. I just spoke with one of our county clerks in this area that said the county doesn't have enough ballots on hand and doesn't have enough envelopes on hand to send to all the voters in the county. What makes you think you can pull this off?
Well, it ain't going to be easy, but we're going to do it. I just have to start with the need for doing it. We have hundreds and hundreds and hundreds of, this is a general election primarily. There's only one race that's a primary. The rest of it is general election. And we have hundreds and hundreds and hundreds, whether it's county executives, whether it's mayors, whether it's county supervisors or school board members, all the people that make huge local decisions. And frankly, the last thing we need is to have all those positions vacant because we haven't had a vote. So we need that leadership in place so we can continue to do the good work. Now, to answer your question after that outburst, I just have to, we have it's my understanding that the Elections Commission has gotten some more election materials. We're going to get it to the clerks as soon as humanly possible. I don't know, Ryan, if you have any additional information than that.
Yeah, so as we've talked about in some previous briefings, one of the things that the State Emergency Operations Center is doing is we have a number of task forces set up to address specific issues. A lot of those are related to healthcare in terms of addressing the hospital surge, related to testing, increasing testing supply. But one of those groups is specifically focused on the election, and they are focusing on people, stuff, and guidance. So we have a dedicated person from the Division of Public Health at the Department of Health Services that's providing guidance to the Wisconsin Elections Commission, answering specific questions, anything that goes beyond what the CDC has already recommended. We're helping on the stuff front, which is what your question was about. So in terms of the Department of Administration arranged the order and printing of more than, I believe it's 600,000 absentee ballots, and we're working on additional orders as the Elections Commission provides us updated information on that. We've also been able to successfully procure and obtain large quantities of hand sanitizer and dispensing bottles for clerks around the state, and are working on obtaining cleaning supplies and other things. And then the final thing is people, which is making sure that because of the impact that COVID-19 is having around the state, it particularly impacts older people, and older people tend to be poll workers overwhelmingly across the state. So we have a big hole to fill. We are doing an unprecedented effort in order to identify volunteers around the state, whether that's state employees, whether that's large employers or volunteer organizations, in order to help support our clerks during this unprecedented time. But the bottom line is, even with these efforts, it's still going to take additional efforts, and that's why the governor was calling on the legislature to make some simple common sense changes in order to make sure that we have a fair and safe election.
Yeah, and I've had the chance to talk to local officials all across the state. Some of them have the concern that you mentioned, but there are more than a handful that feel that the election is going to go fine in their area of the state. So is it going to be difficult? Absolutely, but we will be able to get through this, and we'll get the ballots and envelopes to the local officials as quickly as we can.
Thank you, Ben. Now to Matt Piper from the Sheboygan Press. Matt? And a reminder, *6 to unmute your phone. Matt Piper from the Sheboygan Press. Okay, we'll move on then to Jessica Van Egren from the Up North News. Jessica?
Hi, this is Jonathan Sadowski filling in for Jessica. Governor Evers, on Wednesday, the Board of Nursing, kind of expressed support of reducing the amount of clinical hours that nursing students would need, allowing out-of-state nurses to practice in Wisconsin, and then also making it easier for retired nurses or former nurses to get recertified. How receptive are you to those changes?
Well, I'll let Ryan talk about that because we just did something recently on that.
Both the governor and Secretary Palm recently signed an order that did almost just that. So one of the things it did is it suspended a number of rules and regulations at the Department of Safety and Professional Services, not just for nursing, but also for physician's assistants and some other medical professions, to make sure that people who are qualified but might have recently retired, or folks who are qualified but live in another state, are able to come to Wisconsin and be able to help fill in those positions that we need in the state, especially with the surge coming to hospitals. So that regulatory relief was a top priority of this administration. It's something that was acted promptly on yesterday.
Okay, and we have time for...
Sorry to interrupt. This is Matt Piper. I was having some trouble unmuting there. Could you please help me understand if lower-tier priority patients are now being tested with this expanded testing capacity? Do you know if the commercial and private labs are able to test any of those patients that aren't able to be tested at the state lab?
So Matt, we do have some private labs among the 40 that are up and running and doing what is about 2,000 tests a day in the state of Wisconsin. We continue to prioritize healthcare workers as well as those who are hospitalized and those on the front lines in long-term care and those residents considering their vulnerability. We have not, we continue to not recommend testing for asymptomatic and lower tier suspected cases and continue to push to expand our capacity to test so that we're able to do the kind of surveillance that Dr. Westergaard has talked about.
Okay, thank you. And our final question today comes from Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks. Quick, so I find a few reports or I've heard from pharmacists that there are shortages of drugs that are under investigation for treatment of COVID-19 that are particularly used for autoimmune disorders. And I've seen national reports as well that there are some concerns about doctors hoarding the drugs for their own families and other folks. Have you guys heard those concerns in Wisconsin, and are you planning any action around that? Thank you.
I can fill in some of the situations. So there's some anecdotal reports, some preliminary evidence that a medication called chloroquine, which has been used both to treat malaria and to treat some autoimmune diseases like lupus, might have some activity against patients with COVID-19. It's not the quality of data in a randomized trial that answers the question definitively. There's hope and there's some reason to think that it may be helpful. So in patients for whom a trial of treatment of unproven therapy could be useful, it is being used in a number of settings. There is a concern, however, that we don't want to overuse that or use it without a strong evidence base because we don't want to have a shortage for patients whose management of their autoimmune disease like lupus is a result. So we haven't heard that there is a shortage in Wisconsin. It's a national and international concern because everyone is appropriately looking for anything that can help people who are gravely ill. But we'll keep our eyes closely on the issue and provide guidance if needed. But at this time, it's not a recommended treatment necessarily. But in situations that at clinicians' discretion, any FDA-approved treatment can be used if their judgment that it could be helpful. So it may have a role.
Okay, thank you, Sean. And with that, we will wrap up today's media briefing. Members of the media who did not get their questions answered or asked today should contact DHS Media at dhs.wisconsin.gov, or you can call our media line at 608-266-1683. A reminder to continue to monitor the DHS COVID-19 webpage as well as the Outbreaks and Investigations page for data and guidance materials from DHS. And for questions concerning COVID-19's response that are not related to public health, please visit the websites of the Governor, the Wisconsin Economic Development Corporation, the Department of Workforce Development, Wisconsin Emergency Management, or other relevant state agencies. Thank you and have a good weekend.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.